Azhar Talib is the president and founder of the Malaysian Prader-Willi Syndrome organisation. He's also the father of a 21-year-old daughter who has PWS. And Azhar is going to speak to us on developing a national association, highlighting the importance of setting clear vision, mission and objectives, and the importance of a strategic roadmap, an action plan, and how to mobilise, empower and build up a network. So thank you, Azhar. I'll hand over to you.
Good day, everyone. So today, what I would like to share with all of you, how we are going to develop a national association. And this was based in my country, in Malaysia. So, and our association called IPWSO Malaysia. Today, I would like to share about, first is on the importance of setting clear vision, mission, and objective. Second one will be the importance of strategic roadmap. And the third one will be the action plan. And of course, the final one, how are we going to mobilize, empower, and build up a network? Okay, let us go to the first one, the importance of clear vision, mission, and objective. In developing a national association, there are two elements which is very important. That was recruitment and also planning. In recruitment, of course, you need to recruit patients, parents, caregivers, and family members, and public too. So with a clear vision and mission, this will entice them to be a member. And the second one, with a clear objective, will lead to the proper planning. Let us have a look at what is the vision, mission, and objective. Vision is something that we show about who we are. Like what I put an example here is to create a support group and to create network and awareness among public, patients, and family. That is our vision. And mission is something that what we're going to do within stipulated time. For example, here I'm putting to assess to subsidize growth hormone treatment within 5 years. That is the mission. And of course, the objective is the ultimate goal, what we want to be. Here, I put an example as towards improve PWS person outcome and to prepare for their independent living. And of course, teamwork is the keyword for the success. To achieve, we need a good engagement with all parties and stakeholders. And the next one will be awareness. We should create an impactful awareness where this will be leveraged for the support. If we look at this Pareto principle 80-20, you can see once we increase the members recruitment, the higher the number of members that we could leverage network. Okay. And of course, the third one will be the data management. Data management is the most important element in our planning and processes. Good data collection will lead to a better planning. Let us have a look at the example of data that we need to have. Age group, this is where you can see I've already classified them in 4 groups. One is below 6 years. Number 2 is 7 to 12 years old. And number 3 is 13 to 17 years old. and number 4 is 17 and above kids. This was based in Malaysia situation, where in Malaysia we have, of course, below 6 years is the toddlers, from the toddlers, and the 7 to 12 years is where, as a normal child, they will start schooling period. That called primary school, and the 13 to 17 years old, which we call it a secondary school. And of course, 17 and above, that was adolescents and adult. The next one will be let us look at this diagram. This is the percentage chart. From the percentage chart, if you look at this diagram now, we have 41% below 6 years old kids, and we have 32% 7 to 12 years old kids, and we have 13 to 17 years old kids, 15%, and of course, you can see the yellow one is the above 17 years old. So from this diagram, now you can prioritize your needs for them. You can see the biggest group, more obviously, is the below 6 years. But of course, you have another 13% group, which is above 17 years old. This could be, even though it's small, but could be your priorities too. Okay. And then you also need to know the composition between male and female. So in this case, we have about 57 male and 43% female. Now we look at the importance of strategic roadmap. After we analyze the data that we have, and we could have our priorities, and this is the time now we are going to have a strategic roadmap. The first group that we going to approach are the professional group. If you look here, there are 4 professional groups that we are looking into. The first one will be research university. You can see the research university is important. This is where we're going to develop research-based credential. Means that, you know, all whatever that we're going to discuss, we're going to present to any parties, we have a good credential papers that we are basing for. Okay. Of course, number 2 will be the public and private hospital, where we're going to get the passionate clinician, either a good geneticist or endocrinologist, you know, so that these are the people who will passionate with our group, and they will champion our cause. The third one will be the allied health service provider. This is the group where, like, physiotherapy, speech therapy, psychology, sociologists, etc. And they are the one most of the time will be with us to provide best practice lifelong intervention program. Of course, in rare disease, normally people will be talking about the early intervention, but for us in PWS, I believe that we need a lifelong intervention program. And of course, the fourth group are the child development and special needs educators. These are the people that we need to approach to develop their needs and to prepare the PWS kids now for their independent living. So I would like to highlight one point that all these professionals, they are experts in their field, but then probably they not have enough exposure of PWS. That's why we need to go and see them and explain to them. And this is where professional awareness and support is vital for us. This is ongoing research, education, and innovation, multidisciplinary, clinical, and caregiving best practices, and also well-informed families, special needs educators. That was our objective. That was the first groups that we need to approach. The second one, the next one would be, okay, let us look at the at this diagram. What I'm trying to show is that our priorities and our needs. If you look at this diagram, you can see, okay, before that, that percentage is just to show the analogy, the importance of the subject. Okay, please take note on that, because if you add up, you will not get 100%. You know, I just want to show how the importance of the subject. Okay, if you look at this diagram now, you can see 65%, the biggest will be the allied health service provider. This is where just now I was saying that these are the groups that will be with us for the long life, for the lifelong intervention program for us. And you can see, of course, the medical also is very important for us. Okay, that was the second one, 45% there. And then, and the third one is the child development or special need education provider. And of course, the university research also important. Okay, and now let us see what is the relation between all these groups with the programs that we're going to have. If you look here in university, of course, they will have a research program and also lifelong intervention program. And for the public and private hospital, I mean medical, of course, they have a clinical program. And the last one will be the special needs education. If you look here, university research program will benefit the allied health services. And you can see public hospital in terms of medical program also will benefit child development and special need education group. But the most is, you can see here, allied health services are related to all these programs. From the research programs, they know what is the best solution that they can provide to our kids. And of course, a lifelong intervention is under them, and also clinical program also will give the input for them, and as well as the special needs education. You can see here, the arrow is more on the allied health services. That's why I'm saying just now that allied health is the most important, allied health group is the most important groups for us. Now, the next one, which is equally important for us, will be this group. Fund or funding is the most important element for us. And of course, this will be depends on the places that you are. Even different countries have their different style or different ways of doing things. Okay, in this fund, this group, of course, there are also 3 groups that we need to approach. First is pharmaceutical industries. The next one will be the corporate group, who has the corporate social responsibility program. And of course, the most important is the government policy, which is our government who are the decision maker. Okay, I'm putting there some of our objective will be, if we want to have a residential place, of course we need to have certified caregivers and all that. Of course we need a fund. So these are the group that we are looking at. Okay, the next one, I would say that 3 groups that I mentioned just now was the game changer. That I mean the important groups, which impacting our. Let us look at the government policy, which is where the government has roles to play in terms of policy making processes. So government policy is to promote and to enhance services in the healthcare, not only the healthcare, but also looking overall, where I can say is more is they have to look in not only healthcare, but they have to look in terms of education, in terms of training, in terms of employment, welfare, and other support services for patients and families too. And of course, the second one will be the pharmaceutical industries. This is where they're going to promote the knowledge about medication, and the most important, to ensure that availability of the product and also affordable for us. And of course, in the corporate groups, as I mentioned just now, is to relieve financial hardship patient. This is one way of getting a fund. Okay, so probably other places of other countries, they have a different ways to get fund. Okay, and of course, all these 3, the game changer, will be impacting equitable coverage and also raise awareness and enhance visibility of PWS in all sectors, including that I mentioned just now: health, social, work, education, and research. And of course, as our objective, a main objective, to have an improved person, there are three groups that I mentioned just now. I put it this way: you can see the first one will be the government policy. Good governance and policy will enhance and improve the life of patients and families. And of course, pharmaceutical coupled with clinical and allied health will play a bigger role also, where this is an important entity in preparing the person with PWS towards their independent living. And of course, the third one will be the fund, which is very important to relieve a financial hardship and create empathy. Okay, and now we look at the action plan. Action plan, we look here. Number 1 is we need to have a good planning. With the good planning, with a clear direction, we'll create a good result. And then second one, we need to have a good communication, because we need to engage with all parties and stakeholders in the ecosystem with accurate information. The keyword now is accurate information, which is vital. And then, of course, awareness program is ongoing process. And the third one, the analysis that we have, a good analysis that we have just now, will lead us to a better priorities. And of course, the 3 groups that we look at just now: research to advance and promote knowledge and education by engaging in, encouraging, and supporting research in PWS. And of course, we need to have a good relation with passionate clinician, allied health service provider, child development centers and special needs educators plays important roles. And the most important is the governance and policy maker. Once the policy is there, we have a peace of mind that we can be look after well. All right. So now we go to the last one, how we're going to mobilize, empower, and build up the network. Let us look at this diagram. You can see here that the core will be the association. The association is the core to mobilize all the resources that we discussed just now. And of course, with the good research to provide the credential needs. And the third one will be the professional support to support and enhance. And of course, the most important is the governance and the policy. Again, here you can see the percentage. Please, the percentage is just the analogy to show the importance of the subject. As you can see now, the biggest percentage will be the priorities at the analysis and the planning, and of course, communication. These are the three important points that I would like to highlight. And from there, this is where you can look at this diagram now. The success of our institution is with the support from the professional awareness and support, and of course, with the fund and the good government policy. And the next and the last one will be the time and technology. You know, the time and technology. And of course, I would like to highlight now technology is most important because everybody will be talking about reach and speed. To reach out to people with effective time, of course, we need the technology. Okay. And working with the different stakeholders in the ecosystem about passionate and advocacy. We need to have a good mindset. We need to start first, because I always tell my members that nobody is going to help us. Let us start first. And of course, unite and togetherness make us stronger and resilient, and be focused. And of course, after we have a good association in our country, we need to have a good network too around the globe. This is where we get the better understanding about PWS and make the impactful and our presence felt. No one left behind. Okay, that's why just now I was mentioning about the technology. So at least we must have a website. You can see here, down here, www.pwsa. That is our website. We also have a FB page, and also we have an IG platform. Okay, so with that, in order for us to improve a PWS person outcome, of course, we are looking at the optimum quality and purpose in life to enhance cognition and independence, and not forgetting the families and community social economy benefits and meaningful employment. I believe that strive together, we can do it. Thank you very much. I think that's about all.